when you feel you have hit a wall and you start to contemplate terminal thoughts. It seems like this just looms over your very life. Rest assured, there is always help, whether it's help for yourself or another person. At Houston Community College, we extend awareness to assist those in need of suicide prevention.
The presentation today was on QPR: question, persuade, and refer. What we want to do is to recognize the warning signs and inform the public, the professors and the students, about what those warning signs are so that they can listen and refer to a licensed professional who can evaluate the student and get the treatment that's needed so that the suicide's not completed. Suicide has been rising in this country in the last decade. Now there are more elementary students committing suicide than there ever were in the past. That was an unknown phenomenon in the past. The importance for having these workshops for faculty and students is that so they recognize the signs and symptoms in fellow students or in the students in the classroom so that they can take appropriate action and get those students help. A direct approach is, you know, when people are as upset as you seem to be, sometimes they wish they were dead. Now you've neutralized it a little bit because you talk about other people in that situation might feel that same way too. So you're not saying, whoa, how come you've got all of these strong feelings? You're acknowledging their feelings and you're checking to see, I wonder if you feel that way too. And I think the tone in which you say it has a lot to do with how well it's received. Have you thought about this? You know, and sometimes people get nervous and their speech gets rapid when they get nervous. But it's much more welcoming if you say, gee, you've really been through a lot lately. And other people who've been through that might feel the same way too. That makes it easier to respond. That makes it more comfortable. And so you watch your tone, your inflection, you keep eye contact to show that you're there. So we want people to intervene and ask questions. Have you been feeling sad lately? It seems like, have you been feeling very sad lately? It seems like, have you thought about hurting yourself or committing suicide? And if they say yes, say, well, I'd like to get you some help. Why don't we go to the counseling office and get some help? We want people around this individual that's high risk to be able to respond appropriately, listen, show concern, and get the person to help. A lot of times when people tell other individuals things, it is a cry for help. And so we want them to be able to recognize the cries for help, and get them to somebody who can evaluate them. And maybe they're just having a bad day. Maybe it's just a little bit of depression. That can be helped too. But particularly those at high risk, we want to make sure that they get the help they need.
If you are in need, call National Suicide Prevention Hotline at 1-800-273-8255 or also call the Crisis Intervention at 832-416-1177. Teens can call at 832-416-1199 or teens can text at 281-201-4430. For Stafford METV, this is Rey Molano.